I reflected this morning that it was exactly 1 year ago today that we held an event in the evening to launch publicly the Virginia Center for Health Innovation. It's been a pretty busy first year at the center. I'm excited to be able to stand here and tell you that we've done what I promised you we would do, which was to build a place where you could all come together to collaborate on health innovation, where the different stakeholders in this room could get connected, could share, could engage. And so in a minute, I'm going to have Ashley Cunningham, my Chief Innovation Officer, come forward and actually walk you through our new Virginia Health Innovation Network. So Ashley, if you would come forward, I'm going to take a minute as she's coming up and just talk to you a little bit about why the network is so important. As our speakers this morning have shared, no one in this room can make progress by themselves the way we need to. We need all the stakeholders engaged and working together. We have to change the conversation. One of the most exciting things that I've seen in the last year at the center has been bringing the stakeholders together, getting people to talk about their data needs, their perspectives. This is what has to happen to break down the silos that we currently have so that we all can agree to improving value. And the exciting thing has been that while we talk a lot in the press, in politics about the differences, I would argue today that there are many more things that bring these groups together and that we agree on as priorities. In a very short period of time, we were able to put together the outline for the health innovation plan that you saw with agreement from 70 leaders across key industries. We can rise to the challenge. We have to rise to the challenge. As Dr. Nichols shared with you, Virginia has not done a particularly good job at going after and securing some of these large federal grants. We're hopeful that the network will actually be a tool for people to begin to work together. I'm going to cite just one example. A year ago, CMS announced a challenge for $1 billion for organizations across states to submit opportunities to improve care delivery. Virginia submitted 79 proposals. Only parts of 4 of those proposals were funded. I can't imagine the man hours if I actually calculated. It is not a simple process to submit a federal grant. How many hours were spent on the 75 proposals that were not funded? And the really sad part of it was that many of those had overlap, where if we had brought the stakeholders together, we might have been more successful in getting a grant awarded, say, to 5 health systems and 3 health plans than individual pieces. So that's really what we're working toward. And right now, we have an exciting opportunity because there's lots of dollars at the federal level to compete for if we can work together. We need to accelerate innovation. We need to accelerate the conversation. One of the things that scared me the most in the last year was that many of you would share your ideas with me. And I started feeling this panic of, I'm going to become the bottleneck. If I don't connect people fast enough, we will not be successful. I can't even see all the different permutations of how these things could come together in each of these different areas. The secretary shared 9. There are many partners that want to engage in all of those. That's when the idea for the network came to be, that we needed to have a place where you could connect and you don't need me to be the middleman in those conversations. So it's time for you to join us. Ashley's going to show you the tool that we have created, but before she does, I'd like to take a minute and just thank the sponsors. Because a year ago when I asked these sponsors for funding, I was asking them to fund something that no one had ever seen and no one had ever done. To build a site that, quite frankly, even in the technology industry, we had to bring multiple vendors together to build something because it doesn't exist anywhere else. And so these folks were courageous enough, to be honest, to invest in a vision that's here today. So I'd like to thank, at the top level of sponsorship, Aetna and United Health Foundation. At the next tier, Health Diagnostic Laboratory, Kaiser Permanente, Merck, Pfizer, and Pharma. and at our third tier, the Carilion Clinic, LabCorp, HCA, and Riverside. And throughout the rest of the day today, you may see folks with these cards. They tell you how to get connected on the network, and all of those sponsors should have cards to help connect you. We have them as well.